evening. Today we're going to discuss the childhood obesity crisis in San Bernardino County, California. So on our agenda, first we're going to discuss the leading health indicator. Then we'll talk about segment population. We'll go over the program, the mission statement, goals, objectives, and interventions, resources, the behavior change theory that we're using, proposed benefits to the participants in the community, and the stakeholder involvement. So first, the leading health indicator is to reduce the proportion of children and adolescents with obesity. Currently, that data is at 19.7%. Our target is to get that down to 15.5%. The segment population, we are targeting elementary school kids in San Bernardino County. Now, primarily in that county, that will be Black and Latino children. However, we are targeting all children in the elementary schools, and that will be aged kids 5 through 11. For the program overview, so the name of our program is Healthy Schools, Healthy Kids, and it's designed to increase nutrition education and to increase the amount of physical activity children engage in each week, and an overall effort to decrease the proportion of overweight and obese children living in San Bernardino County. So our mission statement: Healthy Schools, Healthy Kids' purpose is to provide health and wellness information for all students enrolled in public school districts in San Bernardino County, California. Our first program goal is to increase nutrition education amongst elementary school children in San Bernardino County. How are we going to do that? Our objectives include, by August of 2025, 50% of the public school districts in San Bernardino County will receive an educational pamphlet about the upcoming nutrition program set to be implemented across 5 elementary school campuses. Those do include the campuses that have the highest incidence of child obesity. Overall, the outcome we're looking for is for 25% of overweight and obese student participants in San Bernardino County to reduce their consumption of unhealthy foods and achieve a normal body weight. Next, our second goal is to increase physical activity amongst elementary school students in San Bernardino County. How are we going to do that? By August of 2025, 80% of public school districts in San Bernardino County will distribute a physical fitness card to program participants featuring key fitness facts. The point of that is to really get them motivated, have something as a daily reminder. The overall outcome is we want to reduce the percentage of student participants in San Bernardino County classified as overweight and obese. Currently, that is at 42.6%. We want to decrease that to 40.1%. So in order to do that, we have several interventions. Bluey up there that we see is going to be our mascot. In every single classroom, you will see Bluey with a journal, because one of our interventions is the kids will be daily journaling about fitness and what that means to them and what they've done to participate in physical fitness. And Bluey will also have a water bottle, because that's another one of our interventions where we are going to really encourage students to drink those 64 ounces of water that are required daily. Another thing that we're going to do is we're going to incorporate 1 hour of physical activity into the schedule and create physical activity opportunities throughout short breaks. Additionally, we will have pediatricians or nutritionists come on campus once a week to give a 20 to 30-minute presentation to kids so that they can really understand what nutrition is, and additionally to provide different types of exercises they should be focused in doing. We will also build relationships with churches and community gardeners so that we can have those resources available for our students. So when we talk about resources, I've mentioned some: the child pediatrician, celebrity guests. We'll need after-school facilitators for the programs that we want to implement in our after-school program. We'll need pamphlets. We'll need extracurricular breaks during class time. We will need journals. We'll need those water bottles. We will need salaries to be made available for the school personnel we'll be adding on. When we talk about the behavior change theory, we chose the social cognitive learning theory because it states that health behaviors are influenced by interpersonal factors in the social environment. That's why we're really trying to manipulate that social environment and make it more fun, because if you have people modeling that and they have more opportunity for these physical routines, they should be engaged more. Proposed benefits to the community and the kids: lifelong habits of health during their formative years, decrease incidence of obesity, boosted self-esteem levels. We'll have healthier individuals, healthier families. The stress on the healthcare system will decrease. We will have added years to life. There will be a complete culture change that we start to see in the United States as far as eating habits. We'll have more children, and then as those children turn into adults, ensuring that that physical activity is consistent in their lives. Overall, we'll have a lot more happiness and wellness. As far as stakeholder involvement, they have the opportunity to attend school district meetings, sponsor youth sports teams, provide healthy food options to families who can't afford it, and collaboration opportunities, because there will be groups, there will be lots of meetings going on, and that's a chance for them to really get in there and participate. And that is all we have for you today. So thank you for attending the presentation. Here are the sources. Thank you.